hang on a minute, is this actually what I want to
Do
do?
you want to see them?
Yeah, do you know that that's a human?
It could be a dog. It's fine.
Yeah, truly hand on heart believe that if I'd gone in straight from school, I wouldn't have made it. Hi, I'm Maeve. I'm a final year medical student at a university in the south of England.
Maeve, I'm so happy to have you here.
Thanks for having me, Claire.
You're my first guest. So we're just gonna try out this format, see how it works. I don't want it to be like an interview, it's just gonna be a chat.
Sure.
Okay. But I guess you can start with how you first got into like a medical career, how you knew you wanted to be a doctor. I guess that's a good place to begin.
Cool. I mean, it's the absolute classic. I've always wanted to be a doctor. But for me, like, there's never really been anything else. Like, I've always been attracted to medicine. And I really liked science at school, and I did some work experience, and I just thought I could see myself doing this. Um, and it was the draw of really helping people. And so my journey into medicine has been different in the sense of I left school and I had an offer, but my marks weren't good enough. So I did another degree in the meantime. And that was at Durham, and it was anthropology, which is, again, quite different because most people do biomed. Um, but I finished that degree, had a great time, really glad I did it. Took another year out, applied to medicine for a second time, didn't get in again. Third time, I thought, come on, this has got to be it. And finally, I got two offers. And that was 5 years ago now because I'm in my final year. So it's been a bit of a journey, and it's definitely not been easy, but I'm so glad that I stuck to it because I really feel that once I get over the massive stress of this year, it's really going to be amazing.
I
Um,
think also it shows people as well that it doesn't have to be the classic like 18-year-old straight out of school, straight into medical school. Do you think that makes a difference that you've had some life experience?
I honestly, like, truly hand on heart believe that if I'd gone in straight from school, I wouldn't have made it. Like, I really think that taking some time out to do something different or get some other transferable skills or even just life experience, how to live by yourself, how to manage your time, money, all that kind of thing was so beneficial and actually has really, really helped me in medicine as a second degree. And it doesn't mean that because I've done a degree before, medicine's any easier, because it's really not. And it's medicine is like something that is so unique. But I really, really feel that if it's something that you want to do and you get knocked back twice, like I did, if it's really what you want to do, then you just got to keep going for it because it is so worthwhile when you get there.
I think also people think that, maybe they're worried about age or like counting, oh, 5 years from the year I start. But like, it was like the video I sent you yesterday about what was she, 39?
39.
39 when she started her medical like journey. Like, that is just crazy. And it shows that actually age isn't an issue at all. And
And
she
probably,
will have a
sorry,
career. Like,
yeah, and would make you a better doctor because you actually understand different aspects of life and where your patients are coming from. And you bring, what I've learnt this year is that no doctor is the same. And although they try to standardize us in the sense of this is the path you're on for your whole degree, no one is the same. And everyone can bring something different to being a doctor. And I just think that, like, I remember my mum said to me, because when I started, I was a graduate and I was on the longer degree program. And I was like, oh my God, mum, I'm going to be 28. Like, all of my friends are going on holidays and they're buying houses and they're getting married. And I am nowhere near that. And I just thought, this is such a massive commitment. And I feel too old. And she was like, Maeve, you're going to be 28 anyway. So you may as well be a doctor and have done something that you really want to do for the rest of your life. Like, I guess I'm literally playing the long game. And I think that whatever age you start, if it's really what you want to do, just do it. You just got to jump, I reckon.
That's such good advice that you're going to be that age anyway, so why not be doing something? Because imagine you got to 28, you're still 28, but you might be doing a job that
Not
you,
happy or
or then you might be 38 and be like, oh, I should have done medicine when I was 25 or whatever it was.
and
Uh,
not saying that it's, any easier going into medicine at 45 or something, because you as a person then have, I would say, more commitments in like a family, or you've got property, or you need an income. So obviously there's a lot of things that need to be considered. But if you're not happy and you know you could be happier, or this is something you've always wanted to do, like just do it.
just do it.
Just do it.
Nike advert.
Nike got it right.
That's exactly what the woman was saying yesterday on that video. Like, and then also the person in. So basically, for anyone that hasn't seen it, it's basically a video of a 40-year-old consultant interviewing well, I think she was 40 as well, and she started her medical career at 38 or 39, and the consultant was basically saying we're both 40 now, and we're both doctors. Like, it doesn't matter that I've had 25 years experience and you've had 3. Like, we're both 40, we're both women, and we're both doctors, so like.
It doesn't matter. And you just never forget the experiences that you can bring
Mhm,
to being a doctor, that someone who's come straight out of school and their whole life has been medicine won't understand or won't be able to give someone. So just remember that you are unique
mhm.
and you can bring something that no one else can. Um, yeah. So
I think
I
patients.
know it's easy for us to say, and it's easy for me to say this because I'm still, quite young,
Mhm,
but you really don't know unless you just do it.
mhm. Just do it.
Just do it. It's what more to say?
It's that. So, what do you think has been your favorite part so far? Like, looking back on 4 or 5 years.
So I am a very people person. And so at the beginning, the way my program is structured is that you do 2 years intense lectures on the pure science. And while I found that so interesting, and I guess one of the things that drew me to medicine is that everyone has a body, right?
Mhm,
Everyone is a human, everyone has a brain, lungs, heart. And so I just find it so fascinating that all these things happen to us and affect us, and that influences our health. And I just can't believe that no matter who you are, where you come from, what you do, you are a human and a body and you have health. And I
mhm.
just found that so interesting that we're all kind of connected by that. And so, although I enjoyed the 2 years intense science, it was a lot, and there was some deep, dark. You're in your 2 month revision break, and you've got exams coming up, and that's where I was like, hang on a minute, is this actually what I want to do? But coming out of that and passing the exams and going into clinical placements where I actually had the chance to see someone with COPD or take someone's blood sugar measurement, that's where I was like, okay, this is it. And this is how I know that this is what I wanted to do. So for me, it's definitely being on placement. And being a medical student, there's pros and cons to everything, right? But being a medical student, you should never forget that you have this privilege of being part of people's lives where they're at their most vulnerable. And, I'll go and chat to a patient and I'll ask them, oh, how did you get on with your asthma inhaler, or what's brought you into hospital? And although you're going in with a focused thing of, okay, I need to learn about asthma, you're going to get someone's life story and they might tell you things that, you know, they've never told anyone before. And it's just such a real privilege to meet so many people and see so many things. Um, yeah, that's what I've loved the most, is the variety and meeting people.
It's like getting a snapshot into someone's life, isn't it?
Yeah.
Like, you catch them in, like you said, darkest maybe day of their life, and then if you can make that a little bit better by just you know, coming in with a smile or introducing.
talking to them, or I went with a patient to have an x-ray done and she was so nervous and I just held her hand and she was like, you know what, that's made me feel so much better about it, thank you. So it's, yeah, you're right, it's seeing people at different points and different stages of their lives with different things going on and getting to be part of their story is what I've loved the most.
And making a big difference as well.
And learning.
Yes, lots of learning. So that's your, if that's your best part, what has been the hardest part?
I mean, everyone has different things that they struggle with, right? And hand up, mine is exams. And I know you're thinking, if you knew that going in, why have you still done it? Like, because my whole career will be exams, right? But that's the thing I've struggled with the most. And it's kind of a shift in, you have to shift in your thinking with medicine, in the sense of there's so much stuff that you have to know. And like, I've only realized recently that there is a reason why there are specializations in medicine: cardiology, rheumatology, surgery. There's special, because there's just too much. Like, the content is so broad. And so you kind of, in medicine, it's very easy to get overwhelmed. And especially around exams, particularly. And I found that I've kind of had to shift my mentality of like, okay, I need to know a little bit about everything rather than loads about certain things, because there's just no way that you can pass an exam like that. And so I think medicine is, again, unique because it is so demanding and you need to know so much about so many things. And that's one of the things I've struggled with, particularly about exams. But it is amazing, again, when you turn up on the ward and you've been learning about sarcoidosis, for example, which is, common, but you wouldn't necessarily see many people in a week on placement. Turning up and being like, oh, that's what I was learning about today, and kind of making them different links, which then are helpful when taking exams. But back to the original question, definitely the exams for me, and the amount of work. And you really need to be organized in medicine. Really, really need to be organized.
So, what things have helped you with your struggle with exams, and like, has anything helped you overcome that fear, made it easier? I know it's always going to be, maybe that's your thing and somebody
Mm,
else might be flying, but I think people can have their thing, but it's ways of coping, dealing with that, so it doesn't over.
yeah. And so, again, medicine is different because you get examined in so many different areas. So, like, we have the practical exams where you're watched taking a history, doing an examination. And for some people, that's a weakness. We have clinical exams where we have to write discharge summaries, or write in the notes on ward rounds. And then we have the knowledge, the core knowledge, which is the multiple choice questions. And that's my weakness. And I've always known this, but it was mostly becoming aware that, this is an issue for me. What can I do to help? Because, as you said, you need a tactic, and particularly if this is going to be my career, then I need to deal with it now. And so I've kind of figured out that there's three key things for written exams that, if you're prepared for each one, then it will help you. So the first one is studying for the exam. So key thing is, how do you study? And it took me 2.5 years into my degree to realize what worked for me and what didn't, and what helped me retain the information that I needed. So first of all, is like your study technique, but also doing the actual study. Like, you can't lull yourself into a sense of security by like, oh yeah, I've read a bit, when actually you haven't taken anything in.
Yeah.
So it's about what works for you and how you study best. Second thing is exam technique. And that for me was a serious weakness. And so just learning that in a multiple choice question, they're going to put in, it's going to be a big chunk of text and you've got a short amount of time. They're going to put in blood results, and you know, there are things in there to distract you. Like, obviously they don't want to catch you out, but it's easy to get thrown, especially if you have no idea what's going on in the question. So it's kind of figuring out how to tackle the exam. And then thirdly, it's about mental strength, I really think, and you know, having belief in yourself that you can do it. Because if you get into medical school, and it sounds so cliche, but like once you're there, you have already achieved so much, because it is so difficult to get into medicine in the first place. And you've had to do so much work and pass entrance exams and do a personal statement and all these things. Just having belief that you have got to where you want to be because of hard work, and just going into an exam with a good night's sleep, good food, and calm. And I guess they're the three aspects that looking at them has really helped me try and overcome my exam difficulties, shall we say.
I think that third part is so underestimated because I think people think, if I've done the work, if I know how to do exams, I'll be fine. But actually, your mindset on the day of exams is so important because let's say you've had, I don't know, a fight with your housemate or a fight with your partner, and then you have to go and do an exam, or something happens when you're walking there. Like all those little things can actually affect you. So I think like what you were saying, like good food, good sleep, good mindset, tried to block out any negativity. And
No
then,
negative energy, positive vibes only.
yeah, don't talk to me. And just sit down, and then hopefully your mind will be clear enough to be able to do step one and two.
And definitely, and I know it sounds silly, but you almost, because you're going to have to do so many exams, if that's a weakness, like you almost have to set up a ritual for yourself. Like, you know how athletes or even football players will go onto the pitch and they'll all say a prayer, or they can do hand gestures or
Yeah.
something, but that's them getting into the mindset. So like there's one guy on my course who always listens to that song Eye of the Tiger
No.
before he goes into an exam, because it's getting him in the headspace. But and I was literally, you know, I think, what the hell? But actually, if it works for him, why the hell not?
If it works, it works. But
So
each to
yeah.
their own, shall we say. It might work for him, but might not work for everyone.
Exactly.
Okay, another thing I was thinking of as you were saying that was within the NHS, obviously everyone plays such different roles. There is an inevitable hierarchy. Um, but within that, who do you think is the most underestimated team member? And I'm also asking you this because you, when I first started, enlightened me and told me more about not even a speciality, a,
A role.
a job role that I didn't know much about, and that is
Pharmacist. Yeah.
hey,
Honestly, Claire, pharmacists are so underrated.
oh,
They, even learning medicine, like we have to know all these drugs, but because that's only one part of our degree, obviously it's important. There's just so much. So for someone who's actually dedicated minimum 4 years of study to drugs specifically is incredible. And like, you don't really hear, well, I certainly didn't hear about pharmacists until I started on placement. And then, you know, some of us have thought, you know, in a hospital, obviously you hear about them in the community, but in a hospital, like you're part of the MDT, but what is your particular role? And I really, really, truly believe that pharmacists are so underrated, because they know their stuff, they know the interactions, they check everything thoroughly, and say, if you're a doctor, you've got, you know, 60 things on a jobs list that you have to do, and you're just going to try and get them through as fast as you can. The pharmacist is a godsend, because they will be checking. Hopefully you haven't made any mistakes, but if you have, the pharmacist will know. And there's such a wealth of knowledge that you can call them up and say, I want to give the patient this, should I be worried based on their past medical history? honestly, their minds are incredible. So really underrated. And I mean, from what you've said, you've had a lot of um, really insightful experiences with them as well.
I think also it's interesting because obviously they can prescribe too, like doctors or nurse practitioners or whatever. But I think the important thing is with them is they try to. This is from talking to the pharmacist on where I work. She was like, you have to, as a pharmacist, try not to prescribe things. So obviously, if somebody comes to you and they're like, oh, we need antibiotics or we need IV paracetamol or something like this, she was like, we tend to let the doctors do it or the ANPs do it, and then we check the prescriptions. So, like what you were saying, they're almost like the second step to make sure that no mistakes have been made. Because obviously, if they prescribe everything, then who checks their prescription?
Very
So
true. Yeah.
they have to sit back and almost not wait for the prescriptions, but then at least they can see with a fresh pair of eyes, actually, there's something wrong with this dose, or it's actually the wrong drug, or allergies and things like that. Very underrated.
Definitely. So if you're a medical student
Good
or
job.
nursing student, anyone, make friends with your pharmacist.
Isn't your friend the pharmacist in London too?
Yeah, she is. And some of the things she's told me, just incredible. But yeah, they really know their stuff. And so please, they've dedicated their whole career to this. So make use of their knowledge.
Yeah. I remember one time I had to ring a pharmacist on call at 4 in the morning, and I thought they would just be in the hospital. And she was so nice, and she answered the phone. She was like, "Hi, like, what can I do?" And I was like, "I'm really sorry to ring you." It was like really specific question about one drug, and she was like, I'm actually at home, and I live 30 minutes away, but I can drive in now if you want." And I was like, "No, it's fine.
Oh,
Sorry." I was like, I'll try and find anyone else. And then she, from her bed at 4 in the morning, signposted me to, where I could get the drug. But
like they do on calls too, which I don't think people realize.
I know.
They are incredible.
And they may be at home, but they're willing to drive half
30 minutes just for you.
4 a.m. I was like, I can't make you do that. I was like, go back to sleep. Goodbye.
Good night.
She was like, can you ring me back if you manage to get it? I was like, no, no.
No.
Like, I'll deal with it. It's fine. Yeah, great. Okay, what do you think is the one piece of advice you give to somebody who is starting their medical journey? So obviously we know that this Wednesday is Black Wednesday or Welcoming Wednesday.
Welcoming Wednesday, Fresh Wednesday would be
Yeah,
good.
lots of
Yeah.
positive connotations to it. But obviously you're not there yet, but what advice would you give to someone at the very beginning of their journey?
Do you mean like starting as a doctor or starting a medical degree?
A medical degree, because well, you can give them advice
Oh, then
above
I'm not
you.
qualified for that yet. Get back to me in a year.
You'll be right.
um, so, from what I've learnt, you need to be organized. Like, you really just have to be organized because it's like a barrage of information coming at you, and there's so many different components and so many different things that you need to do. Just write it down, write a list, get it on a, I print out big, month planner days and write down everything that I need to do because unfortunately there is so much stuff, and if you don't write it down or get it in a diary or put it on your phone in the notes app or something, like you will miss things. So definitely be organized. And like medicine is very overwhelming, and it is, and it can take up your whole life if you let it, and if you want to let it, and if that's who you are, go for it. But like I like having friends outside medicine and doing different things because I think it's important that you don't lose touch because medicine can be very, you
Dark.
basically get on a hamster wheel and you're on it for the rest of your life because it's your career. So definitely have things outside medicine. And when it comes to placements, I know it sounds so stupid, Claire, but like turn up, introduce yourself, and have manners. Because at the end of the day, if you don't make an effort with the people, like you are reliant on the staff on the ward to teach you. So if you just turn up expecting them who are on their, you know, 8 hours into their 12-hour shift, who haven't had a break, haven't been to the toilet, if you expect them to take time out of their day to teach you when you haven't even said, hello, my name is, forget it, because it's not going to happen. And I know you've had experiences with students, and it honestly makes such a difference
Such a difference.
when you are there, you're present, you're proactive, and you're polite.
And that's all it takes. Like, hello, my name is Maeve. I'm a final year medical student. And then
Mm,
you're like, oh, okay. So we both know who each other is. We can go from there. If then you come to me in an hour and say, oh, do you have an ABG? Do you have an ECG? Yeah, sure. Of course, Maeve.
yeah.
Be- you've built that connection. It's not this randomer who's coming up to you asking for things when actually 2 hours ago they've ignored you. So I think
Or
there's
you have to call security because there's been a weirdo like lingering on the ward for 2 hours when actually it's a med student who's just not introduced themselves. But like no one knows who you are unless you say.
or just waiting in the like waiting by the nurse's station till the consultant comes for ward round. Like obviously ward rounds are very important, but I think also the medical students like you who get involved with everyone gives you the best chance of getting the most experience, but also it's nicer for everyone on the ward because nobody wants to be just like, this random person in the corner until the consultant arrives. So I
And
think
hmm,
knowing that everybody can teach you something
and
is.
to be honest, like I'd actually go the opposite direction and say, Claire, that I have gotten most of my teaching on a ward, not even from the consultants,
Mhm,
because the nurses, the HCAs, the physios, the pharmacists are all incredible and actually like spend the most time with the patient. So they know. And obviously, there's things about management plans and ordering x rays and stuff that you need to talk to
mhm,
the consultants about to see how a ward round is done, or speaking to the juniors. Like even the junior doctors are incredible and they're the ones that have the most stress. But most of my teaching
mhm,
about doing an ECG or, learning how to take a swab has all been
mhm,
from non-medics. So
mhm.
really, please, I would say the biggest advice is don't go in being like, I'm a medical student, I need to be with the doctors, because you won't get much done and you won't learn as much.
And I think also a good piece of advice as well would be to probably like spend time with junior doctors. Like if you're finding your medical student, if you're running after the consultant, like that's great. You might see,
Super
you know,
rare condition.
diagnosis or you might get to see a surgery, but next year you are not going to be operating on someone. You're going to be doing the daily basic job.
Jobs list. Yeah.
So, like spending time with F1s, F2s, seeing jobs that you're actually going to be doing, surely that is so beneficial.
Yeah.
Instead, because then when you start your job, you'll be like, oh, oh, Sally, whoever Sally is, taught me how to do this, like when I was on my final placement.
Yeah.
So I
Make
think
make
probably
make the most
make the most of everyone.
of everyone.
So I guess
Every
that's
everyone.
That's your piece of advice then for like anyone really working in the NHS as well, not just.
For sure. And there is a reason why there are specific job roles, because no person knows everything
Mhm,
and no role is the same. And if for example we didn't have HCAs, then the ward wouldn't be able to function, because everyone plays such an important role and brings different things and different skills and different experiences that makes the NHS what it is.
mhm.
And it wouldn't be like that if everyone were nurses or everyone were doctors. Like it's not possible. So appreciate others around you,
Yeah,
I think, is the key thing.
everyone has a role. So what would be your I guess it's maybe too early to tell, but what would be your dream role? And why would that be your dream role?
Oof.
I know it like you might say something and then get to do it and be like, actually, this isn't what I imagined it would be. But what at the moment are you like, oh, that I think that's my thing.
I think for me, it's either dermatology or pediatrics. And I think I did most of my pre-med school experience in dermatology, so I feel more comfortable with it, and I just see it just seems to click a bit better. But then I had an amazing peds rotation, and I really think it depends on your consultants and your teachers and the staff that support you on the placement as to how much you connect with it and enjoy it. But and they're two very different specialties, and there is dermatology within pediatrics, so like it's quite broad areas, but I
Mhm.
think those two are the ones where I could see myself doing it. But obviously, get back to me in, I don't know, 20 years when I'm a consultant, and it might be in urology, for example. But I think I figured out more of what I don't want to do,
Mhm.
which I think is quite important in medicine because there's so much that you can do that it's important to figure out what I don't want to do. So if you ever see me doing surgery, we need to have a discussion because I'm telling you now, I do not want to do surgery.
Process of elimination.
Yeah,
And I guess seeing people like in those rotations where you might, see like a dermatologist and be like, actually, I see myself in you. I guess that makes it easier because you're like, oh, I could do that. She's similar to me, or,
yeah,
well, maybe you don't see yourself as a surgeon because a lot of the surgeons are not like you.
exactly. But then also, I remember a consultant saying to me, like, how they figured out where they got to where they are now is that you need to know and be comfortable with the bread and butter of the specialty. And that's the things that you do day in, day out. So, like for dermatology, for example, it's mostly clinics, which is great if you like working during the daytime. But if you're someone who, like me, every once in a while would like a little bit of spice in that you're doing an on call or a night, then, and seeing the interesting cases, but
Mhm.
not very often, you need to be comfortable doing what a dermatologist does day in and day out.
Yeah, that's a good piece of advice actually, because it's not all just going to be like running to A&E for necrophagiitis or something.
No, that might be like once every 3 months or something.
Yeah, but I guess, yeah, the day to day, the bread and butter.
And the amazing thing is, God, this sounds like a massive promo for medicine, but the amazing thing is, like, I could do dermatology, but if I did that for 10 years and then realized actually I really like medical education and I really want to teach, then I could do that alongside my job.
Mhm.
Or maybe I want to do research and I could do that alongside. Or actually, I'm a dermatology consultant and now I want to go back and I want to do respiratory.
Mhm.
Bit of a jump, but it's possible because you've got the core degree, um, and the set of skills which really can take you anywhere.
It's a passport to the world, like my mom
It
says.
sure is.
You can do it anywhere. And like, there's always going to be the need for doctors and nurses, and there may be robots, but they can't
They
take.
can't talk. Well, can they talk to humans?
I said they can't take away these.
They can't.
Getting eyes on the patient, very important.
Look,
That's another,
robots don't have banter, so.
that's another piece of advice. Going to review, very important.
Ah, yes, that is something you have mentioned.
None of this, I'm sure it seems fun. Uh, do you want to see them?
Yeah, do you know that that's a human?
It could be a dog. It's fun.
Yes, that's something you've taught me.
When will you be here? No, I'm not coming. Okay.
Meanwhile, the pharmacist was already in her car on the way to the hospital. So see the patient.
Yeah. Eyes on. No robot can do that.
Nah, oh,
I think
yeah.
I think that's it. What a
Thank
way
you so
what
much.
a way to end.
What a way. Open, open, open.
Good.
Open eyes, open ears, open mind.
Open heart.
Thanks, Claire. Thanks for having me.
Bye.